Hello and welcome to Healthy Seminars. My name is Lauren Brown. I'm the moderator. I'm also a clinical director of AcuBalance. I practice in Vancouver, British Columbia, Canada. I'm a doctor of traditional Chinese medicine. And I'm going to do a little housekeeping before we begin our presentation today. This is presentation number 2 or module number 2. It's called Virtual Consultations for Your Pregnant Clients, Building a Community Practice. And today we have 3 presenters and 5 panelists. We got Zena Kocher, Kate Levett, and Emilie Salomons presenting today. And then they are our panelists, as well as Debra and Claudia Citkovitz. Emilie is from Canada. We'll do it by country. Kate is Australia. Zena is the United States of America. Claudia is the United States of America. And Debra is New Zealand. I think I got that all correct. And so we're really excited to do this again, because we did this a couple of weeks ago. And during the webinar, if you have questions, feel free to raise your hand. And at some point, we'll get to you and open up your mics so you can connect with your team. I just want to let you know, if you missed the first one, we put the replay back up here. So on their page, they have a dedicated page for virtual consultations. If you scroll down to the bottom, here's the first one. So an excellent presentation of our presenter. So do go check out this page, and you can find out more about the last lecture. And this is where the replay for this one will show up as well. I also just want to let you know that we have a resource page for you. So it's healthyseminars.com/resources. And you can find that on the homepage now. There's a link for it. Our whole goal is community, unity, immunity. This is why our cameras are on. And at the end, we open up our mics so we can all kind of connect with each other. And you can find the different topics. They're all anchored here, meaning if you click on one, like this is what we're doing today. Where is it that we're doing today? We're doing this one here, number 7. It will take you down there. And so then you can click here, and this will take you to the page where the replays are. Okay, so just want to let you know you can get that from the resource page. And just below the top of the resource page, we have what's scheduled today. So we just had this one with Ed Neal today, and then this is where you are today. And then there's something happening every day this week, and we keep adding. Our whole goal is to create community. And so hence your cameras are on, and we open up your mics at the end to connect. And we want to provide you with a learning opportunity so you can fill your minds with knowledge, and then take this and share it with your community. And a lot of people are doing telehealth. And so this series that these amazing practitioners are sharing with you is about how to do this through telemedicine with your patients that are pregnant right now. So I just want to let you know that's the healthyseminars.com/resources. We have some upcoming live webinars, which you can click here to find out. And then at the very number 9, we have a discount. I will let you know that all of our pregnancy courses, we got by Claudia Citkovitz and Debra, our speakers here today, 2 of our speakers, they're all on sale at 25% off using the coupon code HEALTHY25. If you are so desire of CUs and want to study with them, that coupon is valid until April 30th, as long as we're in isolation. And if isolation continues, then we will keep the coupon going longer than that. And all the live webinars are already on sale, discounted, so the coupons do not apply. So our first presenter today is Zena. So Zena, let's bring up her PowerPoint. And I'm just going to go Zena, then I believe Emilie, and then I believe Kate, and then all 5 will be on a panel. Oh, thank you for this slide. Our disclaimer, I want to remind you, this is for educational purposes only. This is not medical advice. This should not be received as medical advice. If you have a health condition or if you are pregnant, please seek out a healthcare provider, because this is for educational purposes only. All right, let's make sure Zena is unmuted, and let's take it away.
Can you hear me okay? Great. Thank you so much, Lauren. I have to just say, this is such an awesome thing that you're doing, especially in times of isolation and so much change and so much unknown, that it's just really important that we come together. And I think the way you've framed it is community, unity, immunity is just perfect. So thank you. This is really awesome. In conversation in MAMPS, there's been a lot of discussion about how do we deal with fear with pregnant women, because this is a huge issue. And in that discussion, I began to reflect on the fear that I see, and I see I've gotten to learn from women with high-risk pregnancy who have been hospitalized, isolated and hospitalized for long periods of time. I was able to reflect upon that and come up with kind of 7 points of wisdom that I have learned from them that I thought would be really helpful to share with everybody today in terms of fear that's specific to being pregnant and then just fear in general. So, like, for instance, people come in for high-risk pregnancy, come into the hospital for lots of different reasons. Preeclampsia is a really big one, and often with diseases like that, people are living their lives normally and often very full lives. They might have other children, they might have a parent that they're taking care of, pets, a house, relationship. We all know how full our lives are, right? And then all of a sudden they go for a checkup. Everything's been fine in their pregnancy, and all of a sudden they have high blood pressure. They're taken away from their life. They're brought into the hospital, kind of isolated, and have to manage their life from this place of isolation, and also kind of being evaluated every moment. They're faced with a disease that could kill them. It could kill their child. It could affect their child or children, so that they would have to come early. And there's just so many unknowns about the disease. And there's unknowns about the etiology and even the timeline of it. It's really overwhelming. And so these women in high-risk pregnancies, I just kind of want to paint the picture so you can understand why it might be a good parallel to women today who are pregnant in this COVID time, when we just really, it's not really clear how long it's going to be, how it's going to affect us. And so I really think there's a lot of wisdom to be had around that. Let's see if I can change my slides here. Okay, great. So fear often looks like, it looks in terms of what it looks like, it's often what we're actually afraid of. And in our case, we have this fatal virus and these impending changes. Our economy, our communities worldwide are changing dramatically. There's a lot of destruction, a lot of fear and unknown, but we still really don't know. We're in the middle of it. We're in the middle of this huge transformation, huge change. And it affects us individually and collectively. And we also don't really know what's causing the destruction, so it's hard to know how to address it. So the whole thing is overwhelming. I wasn't quite sure if I should put a picture up of the zombie apocalypse or the tornado. I decided to stick with the tornado, mostly because I think there is this, you can actually feel fear when you look at a tornado. And the other element of a tornado, which will be important for this discussion today, is that there's calm. We all know that there's calm in the center of the tornado. So that is a kind of essentially what I want to share with you today, that I've learned from these women. They've been able to find this calm in the middle of this. We have this extended tornado, so it's kind of having to recreate that extension of that calm every day, every moment. But we all know the importance of that, finding that center and that calm. Then there's the question of, how fear affects us individually. And we all have a very strong pedagogy and paradigm of understanding that in terms of Chinese medicine, how it affects the kidneys, and it can cause low back pain, insomnia, anxiety, urinary problems. And the key, I think the key to working with pregnant women, especially since this isn't just their own personal fear, it's also fear surrounding them, is actually to find out what they're afraid of, what their fears are. Really listen and validate what their particular fears are, just in the way that we do Chinese medicine in general, tailoring our treatments to them. It's the same thing with kind of assessing fear for them. And the other thing I want to say about fear while you're being pregnant, it's really a different thing to experience something individually, just as yourself, versus being pregnant and or being a mother of other children while you're pregnant. When I I didn't say this up front. For those of you who don't know me, because it looks like I don't know a lot of you out there, I work at a hospital bringing acupuncture and integrative medicine. I've been doing it for 15 years. And I also been specialized in mother baby and working with high risk pregnancies. That's why I'm talking about this today. I had the experience of providing acupuncture to people who've had all sorts of, operations, spinal operations. Those are the ones you come and you ask them if they want acupuncture. And even if they've never had it, they're like, oh yeah, whatever you can do to treat this pain. However, when I would go to these women who would be either in a lot of pain with headaches and high blood pressure and high anxiety, who maybe even had acupuncture, loved it, I would offer it to them, these pregnant women in the antepartum unit, and they often would be like, well, I don't think so, not today. And it's just this funny phenomenon that I started to witness. And it's become really clear that when we're pregnant, often women are just they have to be the ones in charge. They're the parent. They have to be. They can't really let down their guard. They have to be vigilant and alert and aware and on the ball and in control. And it just it highlights these kind of situations. Just highlight that they're not. And it's very overwhelming. And women are often very guarded. And it takes a while. It takes really actually creating trust and rapport with them before they will agree to have acupuncture or other treatments. So I just want to point that out, that this being pregnant in this time of fear and having fear is just a whole different level. And that's why it's so important to really listen to and affirm their fears. So, like I said, I have seen a lot of women suffer being kind of plucked out of their lives and their dreams of how they wanted to give birth, how they wanted to be pregnant, even being dashed. And some people are really able to transcend this and actually thrive in the hospital situation. And it's really been from those people and the ones that are also suffered from those experiences and watching that I've come to these lessons that I've learned. And they're really, really pieces of wisdom that these women have earned. So that's what I'm sharing with you today. And the first one is learn what is known about the disease and use that information to base your decision on your next step. And like I said, with something like, well, we get women that maybe have placenta previa or just unknown bleeding. And that is one of the more stressful things. Every time they urinate, they have, when they wipe, they might have blood. And then that might mean that they're going to have their baby that day. And they just never know. And it's super stressful. And sometimes they know what the bleeding comes from, and sometimes they don't. And it's just really, it's about learning what there is to know and learning what the possibilities are, and then going from there to make your decisions. And then there's the other added step in these times of unknown, that what you knew yesterday will change. And so it's kind of knowing that what you know now might change tomorrow. And so basically, it's the same with COVID. Everyone knows, wear masks, don't wear masks. Gloves are the thing to do. Nope, it's just washing your hands. All of that stuff, and the changes of what authorities are saying about it, and especially we feel this here in the U.S. It's probably different everywhere, but all of that can be really stressful. But just if you can just stick to what you know and stay on that, and know that it might change, and then the next day decide to make the decision with your new added information, that is what one of the primary ways that I've seen women function with this. The other thing is that when women are deciding where they want to give birth at this point in time and who their caregivers are, it's again to just support them in finding out what information feels right to them, and who who they feel most comfortable with and making those decisions based on that. There's just a lot of unknown right now. The next lesson that I learned, and it's a little bit like Al-Anon lesson, but that has been super key for these women, is take one day at a time. We often get people who have pre-ruptured membranes, premature pre-rupture membranes. So their membranes might rupture at 23, 24 weeks when it's considered that the baby is still viable. And then it'll be admitted to a hospital. And then they will have to stay there for 11 weeks. Again, isolated out of their homes, not in their normal clothes, nothing of their surroundings, having people come in and out and evaluate them and critique them and come in their rooms kind of whenever they want because it's in a hospital. So that's a long time to be in a situation like that. And again, have your pregnancy dashed. So a lot of times this idea of just taking one day at a time and just focusing the things on that day are essential. Women often would have a calendar and just X out the days that they completed, or they might do the opposite where they'll make a special chain where they put a new link on their chain, like a paper chain, and just fill their room so they can kind of celebrate that they have made it there for so long. So this taking one day at a time, when like with the COVID, we don't know how long this is going to be. And if we think, oh, I'm going to have my baby in August, I'm going to be like this the whole time? What is it going to be like in the hospital? It's natural to think about those things and troubleshoot. But then as soon as it also gets us in this anxious place. So do what you need to do in that realm, but then remember to come back and just focus on the things of that day. And kind of, it's that whole idea of being present in the present moment to an extreme, really. And just having this be a practice will be really, really essential for moving through this time. The next one is focus on your wished outcomes, which often are things like, I want to have a healthy baby, I want to be healthy myself, and I need a support team. And this one is really good to reflect, have the pregnant woman or yourself, if you happen to be pregnant, really to reflect on actually what is most important to you. There was a woman who came probably about 5 years ago now that came with twins, and she was hoping to have a water birth at a birth center, and she had premature pre-ruptured membrane on one of the twins, so that was not going to happen. And she came to the hospital. She was devastated, and I totally understood why, especially because I knew what her plans were. But I still asked her, I said, well, why was that important to you? I understand, ecologically and all that, but what was underneath that? Why was that important to you? And she said, well, because I want to be connected with my babies. And what was so great to actually hear that underlying cause was I was able, because of my experience, I have very similar ideas about pregnancy as she did, but I have been able to see pregnant women who've had babies taken early from them, and yet they're still connected, still bonding. Their milk comes in right away, all those kinds of things. It doesn't have to be that if you have a C-section or that if you have a medicalized birth, that the connection's not there. So I was able to share those stories with her. And then I asked her, so, well, how are you connected to your baby now? And she looked at me and she realized she wasn't. She had been so nervous about the fact that she was there and about concentrating on having a water birth and finding the right clinic for that she hadn't been connecting to her babies at all. So what she really wanted, she wasn't even cultivating. She was doing it outwards, not inwards. So it's really important to just support the underlying wishes of what someone really wants and help that to be the truth. And what ended up being really great with this woman was she recognized it right away that she hadn't done that. And so she figured out ways that she was going to connect with her babies. I gave her some birth videos of, natural birth. And so she was able to visualize over the weekend. And then she ended up having a vaginal twin delivery in a hospital, which doesn't a hospital, especially back then, wasn't doing that too much. So she really was able to transcend from that. Another one is become aware of who supports you. Now, this is a really, really important one, and this will be a little tricky with the COVID, so you'll have to be creative in figuring out how that support will exist for you. But I think often people forget about their own resiliency, forget or take for granted the support that's around them. So it's really a great and important conversation to have with pregnant people about who's supportive, and to even ask them questions about how they support themselves or that they don't support themselves, however that works, however that question is. And faith will be another really big one. And a lot of things that people can do is they're letting people FaceTime in the, during deliveries and births. And there's also ways that you can play music that remind you of people. There's guided imagery that can be done where you can just feel the people around you. There's all sorts of ways to be creative about this. And this is going to be essential for people to really live into that support and create that team. They could have sounds. If animals are supportive, you can have your animal sounds, different kinds of things like that. This one is practice ways of being that bring you to your center or your best self. So again, this is another one where people have habits and things that they do, and you might have to dig a little deeper, like what are the essential things, and have them make a plan of how they're going to practice that every day or just become more aware of it. And again, this is such a personal thing that there's not a right way to do any of this. It's just a practice, and that this becomes a time of practicing all of those kinds of things. So this can be linked to their outcomes and their goals. Like often I will have, there was a woman recently who had twins, and they both were IUGR and small. And I was telling her about the acupressure points that she could use doing that, stomach 36 and kidney 9. And she was a religious woman. So I said, you can send prayers to your baby while you're doing those points. And she just loved that idea. She just loved it. So there's ways that people can do self-care and practice their own ways to center themselves. What else do I want to say about this? Yeah, basically, what we're doing here is helping people find their own ways of resilience. Again, becoming more aware of it. We often do it just because it gives us comfort, but if we're actually even more aware of it, then we can really consciously aware of enhancing the life around us. We can enhance what is life-giving to us rather than just be in this constant state of worry. And again, I call it a practice because this isn't necessarily the easiest thing to do when you're stressed out. Make decisions from your best self, the place where you're centered or in that calm of the storm, and give yourself space when you are not able to make that, when you're not able to be centered. It's okay. It takes time to find that centering. It's, again, like I said, a practice, a cultivation. But to try to make your decision from that place as best you can. And again, I learned it from a patient. There was a woman she had just been admitted, and she was completely stressed out, and she had a vasa previa, and she was bleeding, and she was probably going to be delivered early, and her baby was going to be early, but it had subsided a little bit. We had a NICU nurse that was coming in to give her the lowdown of the NICU, which is really good information. However, it also is very stressful for people to receive those pictures of the possibilities of their babies being so early. And this woman knew right away. She said, you know what? I cannot take in what you have to say to me right now, and I know it's important. Can you come tomorrow? And just knowing that about herself, like she wasn't in a place to take in the information or make any big decisions. And it, turned out that the doc could come the next day. So it's just really important to give yourself space and know and just become aware of when you're in a little more centered place. And also know that our best selves are of that moment, right? I mean, we always know 10 years from now, oh, if I had done that or whatever, but but we didn't have it at that point. So it's recognizing your best self in that situation and just being grateful that you can get there when you're there, and knowing that we'll always have more perspective in the future. And then the last one is to be patient and kind to yourself. There's so much change, so much ungrounding and turmoil and unknown and fear and death and loss, so much going on that it's important to let yourself process and grieve and have anger and have all those things, and just to be patient and kind as we're trying this practice of cultivation. I think we all know that it's that whole space and grace thing. We all need to just give it to each other and to ourselves. And basically, essentially, the way I see this is that last picture that just disappeared is really the what we're trying to achieve. It's the first picture with the fear coming in on that person and the space all around them. That's where we are, and we have this opportunity to fill it up with life, fill it up with validation of our present experience, find our resources to grow into motherhood in this situation and parenthood. And we all know how difficult that is. Talk about an unknown new territory. Being a parent is a constant one of that. So really, it can become an opportunity to prepare for parenthood and also to prepare to become our bigger selves. And it's about meeting these situations in our best selves so that we can transform them and transcend them. And again, everyone's going to do that in their own way and at their own time. Our job is just to support that and help draw that out and help people find their resources. And fear is just a place to play with that, if you will. So it's not denying any of the struggle and any of the terror and rage and grief. It's just acknowledging it and helping to cultivate a more resourceful self. So that's what I have for today. Thanks a lot, everybody, for listening.
Thank you very much, Zena. That was lovely and informative. Next up will be Dr. Emilie Salomons from Vancouver. No, it's Kate from New Zealand. Yes. There's 5 people. If I keep going, I'll get it right eventually. So next up is Kate Levett, who's brilliant. And Kate and I have been chatting about her doing more comprehensive courses on healthy seminars because I've gotten to see what she's up to and I'm blown away. So I'm looking forward to your talk, Kate. And Kate is from Australia. See if you can take control of the PowerPoint, Kate, and let's see if your audio is working.
Yep.
So everybody, your questions, just keep them. You can post them in the chat room to remember them. But after the 3 presentations, all 5 will sit on the panel, and then we'll get you to raise your hand digitally. There's at the bottom of the laptop is where you can digitally raise your hand, and then you can make your comments and your questions then. Thanks, Kate.
Thanks, Lorne, for the introduction and the opportunity to be able to talk. I'm really grateful for the forum that you've set up here and that we can get together from the 4 corners of the globe and discuss these tips for pregnancy in this time where we're all, sharing. It's probably the one time it will ever happen that we'll be sharing this experience in every country in the world. So we're all in a similar boat and looking for ways that we can help our clients because people continue to be pregnant and need to give birth, and we're being restricted in what we can do in hospitals and in other ways in our clinics. And so I think maximising our skills over virtual consultations is really important. So I'm going to talk just briefly about some gua sha and cupping, which can be extended further. And I've got a couple of little videos here that I've put in and other videos that I didn't upload, but I'm happy to put on a little website if people are interested in, just so they can show their clients just little videos about how to do these things. And I'm grateful for my own children at this point. All three of them were instrumental in getting this together. One videoed, one was the model, and then one edited. So I think it's the only reason I had children, so they could help me do these sorts of things. So we're going to just talk a little bit about gua sha and cupping and the way in which we can use these in for our pregnant clients and for anyone else who might be experiencing some musculoskeletal issues. And this also is good for autoimmune conditions where there's joint aches and pains. So we can use this in a variety of different scenarios. So when we think about what we can do, we need to plan ahead, and often that is about thinking about this particular client that we're going to see, getting a good history maybe beforehand, and sending out the appropriate bits of materials so that they can do this. You can see in this picture here, I have a client, she has chronic asthma, and her partner is putting cups on bladder 42. And we worked through how he would find them, how he could place them, and she did have some good temporary relief from her asthma symptoms while she was in a change of season time going into autumn here. And that works really well. She knows how to do it, and she knows when her partner can use them when she can't get to other treatments, or she's needing an acute kind of assistance with her asthma. So if we're just thinking a little bit about, I want to talk about stomach chi. So this is going to be the basis of what I'm going to talk about with the gua sha. Just thinking about our three treasures, which we know are Jing, Qi, and Shen. And when our Jing and Qi are strong, it is a really good foundation for our Shen or mind. And when the Jing and Qi are healthy, the Shen will be happy. But if Jing and Qi are both very deficient, then we know our mind suffers and our overall Shen suffers when we're not well in other ways. And thinking about the stomach and spleen Qi representing our postnatal Jing. And our postnatal Jing also supports our prenatal Jing. And in the 15th difficult issue in the Nanjing, the emphasis is on stomach chi, the importance of that, and how the stomach chi nourishes all organs and protects the bodies from climatic changes, which is important in our seasonal transitions. So this is just as a little way of background for why we're looking at stomach chi in particular. And in my treatments, I use a stomach chi treatment at the beginning, the first, second, or third thing in the beginning of a treatment every single time almost. So thinking about our postnatal Jing or our stomach chi, we know that it's extracted from food and drink and that it's metabolized and processed by the spleen and the stomach, and that the essence of this Jing forms the material basis for our internal organs, metabolism, and it really supports our kidneys. We're always using the postnatal Jing, so we don't have to really dip into our prenatal Jing. And when our prenatal Jing is functioning optimally through the postnatal Jing, then we're supporting the functions of the prenatal Jing and then also postnatal Jing transforming into Qi. So each thing, we all know this from our training, each thing supports the next. So when we've got good postnatal Qi, we can support our kidneys, which in pregnancy is particularly important to be able to support all the functions and the transformations of growing another human, and also supporting the pregnancy changes that happen, all of the unbelievable constitutional and physiological changes that happen through pregnancy is quite remarkable. And we see that our postnatal Jing can be really influenced by diet, stress, and the environment. And in particular, stress is a really big contributory factor to pregnancy issues that we're seeing right now. what I see often when people they come in and they've got lower back and pelvic pain, or they've got neck and jaw tightness, these two things will be reflected in the other. So if someone comes in with a sort of their pelvis feels a little bit out or feels a bit unstable, invariably they'll have neck and jaw tightness. And so when we palpate around the neck and jaw, and women can do this themselves when they're on a virtual consultation, you will most often find that there's a soreness, a tight jaw through the SCM and also through the neck here. And that can be a little bit of an immune marker as well, that they've got some soreness and tightness through the back of the neck and that they can palpate that themselves. And that will often be seen then in pelvic tightness and a little bit of pelvic pain around the ASIS. And that can be immune related, and it can be influenced by stress and also our stomach chi when we're thinking about the postnatal chi. I just want you to do a little experiment for me while you're sitting out there. And I want you to clench your jaw together, teeth and jaw together very tightly. And then I want you to see how that feels in your pelvis, in the region of your lower abdomen, pelvis. You can feel the tightness coming down through the Ren meridian, and you can feel the tightness pulling up on the perineum. And so I get women to, as they're preparing to give birth, thinking about the tightness in their perineum is reflected in the tightness in their jaw. And how will they relax to be able to let that baby come out and down if their jaw and their tension is held in their jaw and they've got tightness like this. So learning to relax the jaw, make those low, long sounds, particularly through labour, or just to get the body to relax. If you try that now while you're all on mute, you'll see that the whole of the pelvis relaxes too. And then at the end, I want you to give me feedback if you found that happened for you. So thinking about the stomach chi, the stomach is the starting point of all the 12 meridians. So we can think about the stomach as being the ignition point. And in particular, Ren 12, sitting right in the middle of the middle jiao, is where we see tightness when women are feeling stressed and anxious and the stomach chi is not moving. You will feel it around Ren 12 to 14. There will be a specific tightness that you will be able to feel and that she will be able to feel herself. It might be above the fundus if she's more pregnant, or that might feel very strongly, especially with morning sickness. You'll feel a tightness around Ren 12, a little lump around Ren 12 with morning sickness. Getting her to find that so that she's got a pre and post a marker that she can look at, or for men as well, so musculoskeletal pain, so looking for that tightness around Ren 12. And we can see poor stomach chi presents in a variety of signs and symptoms. And so we can see in this muscle tightness, muscle aches, morning sickness, feeling nausea, not in the throat, that's more of a gallbladder thing, but nausea more in the around the sternum, around the stomach, that will be more of a stomach spleen thing. We see seasonal allergies, rhinitis, things like that get worse during the seasonal transition. So traditionally, the stomach or the earth was seen as the center, and as each of the seasons transition to the next, the energy would go through the earth and then to the next season. And so treating the stomach and spleen is a really effective way of treating those seasonal allergies or seasonal problems that get rheumatoid arthritis, things like that get worse when the seasons transition. And in the Southern Hemisphere, we're coming into winter, so it's cold and flu time. Apart from COVID, it's cold and flu time, and looking for things to be getting worse while we're having this flu season. We're coming into flu season. And in the Northern Hemisphere, you're in spring coming into summer, and so you'll see a lot of allergies popping up now as well. So what else are we looking at? Pulses are characterized by a lack of movement. So when stomach chi is low, the pulses get a pecking quality to them. And you may not obviously be able to feel this over the internet, but your patients may have a good sense of being able to put their own fingers on their wrists and feeling if their pulses feel a little pecking and they don't have a good forward movement. So that's what we're kind of looking for, and a change in that. They'll often complain of muscular pain, spasms that seem to come from nowhere, aches and pains that might move, or they just have this low-grade generalized ache. Acupressure from spleen 3 to 4, that massage along spleen 3 to 4, should alleviate those muscle pains or spasms to some degree, so that you know that you're on the right track, that this is a spleen qi deficiency, a stomach qi deficiency, sorry. So how do we treat the stomach qi? We can use needles, we can use moxa, we can use acupressure, and we can use gua sha. And when we're thinking about the stomach qi, we always start with the left leg. We start at stomach 36, and the left side, we start with the left leg because the left side is the yang side, and that represents the qi. So we want to move qi first because the right side is our blood side, and the blood won't move without the qi. So we want to start with the left, and we want to get things moving, and then we move over to the right side. And when you do this, particularly on children, this is very obvious. When you do the gua sha down the stomach qi line, the natural oils in the skin will be released, and the skin starts to take on a silky feel. So you know that you've done your job when the skin feels just a little bit silky. And what you'll also notice is you start to get more moisture in the mouth. So you can ask your clients, is your tongue feeling a little bit more moist now? As they're doing the gua sha down their own leg, or their partner might be doing it. There should be a change to that feeling of moisture in the body, and you can check that through the tongue. The pulse quality will change as well when the stomach qi has been ignited, and it will feel like there's less pecking and more forward movement. So if you can't check the pulse, or they're a little bit liver qi stagnant and they don't want to take their pulse, and they tell you they can't, and they're a bit irritable about taking their own pulse, you can just put that in your back pocket. That's a little bit of liver qi going on there, and you might address some other things as well. So if the moisture should start to appear, and I'm just going to play you a little video about the child in this. You can do this on little kids, but I'm doing it a little bit more firmly, and she's a bit older, 10 to 12 age range. You can start to do it a bit more firmly like you would on an adult. But on adults, you can do this even more firmly, and it can be quite strong. And but on children, I do it very lightly, little children, and this is good for reflux, good for little babies, good for kids who get upset tummies, who have just like little grumbly sort of joint things, or not sleeping very well. This is really good for these babies. So you can see that on the bottom of her leg, there's a little bit of redness that starts to appear. And that often happens with morning sickness. You'll see that that redness starts to happen down the bottom there. And so you can focus a little bit more heavily on that, and just start to move the blood. Every day you can do this. I find when there's aches in the pelvis, so people are getting really tight joint aches in the pelvis, that the redness will appear, and keep going, and you'll feel a little release in the pelvis. I heard a story just earlier this morning of someone who tried this out in preparation, who gets a little bit of tightness through her pelvis, some old injuries from gymnastics, did this on her right leg and got a really big lot of blood stasis signs, so very red all the way down from stomach 36 down past stomach 40, very red, and that is a sign that there's a lot of stasis going on there. And so keep going with that, not to the point where you're breaking the skin, but you repeat the next day, and the redness will start to dissipate as the stasis starts to move. Or skin that is pale like that, you'll see the red coming up a little bit more quickly, or people who are a little bit prone to the allergies like asthma, eczema, the redness will come up a little bit more quickly, and so perhaps go a little bit more lightly on those people. So then for a massage technique, you can also look at how you can do this with a massage. I often tell people to use those porcelain Chinese soup spoons. So if you don't have a gua sha tool, you can use smooth rocks that some people get from, you know, those shops that you get, those craft shops where you get sort of smooth stones. You can use those, or just the Chinese soup spoons. Down the leg, you can do it in yourself. So you put your thumb in the little bowl of the soup spoon and hold on to the handle, and you just do it yourself down the leg, down the stomach channel. Or you can use massage. So that's the line of the stomach channel. Feeling for the little gummies with firm pressure downwards. And then you feel where the gummies are and then start to massage. And this in Japanese acupuncture, the gummies are called kori. So you're looking for little areas of stagnation. And then also you can use cupping. So you can see on here, there's some redness. I had another video, there's some redness under here where I did some gua sha in downstrokes down the back, down the bladder channel, and down the bladder channel on both sides, and then out, fanning out over the ribs there, under the collar, under the wing bones and across the ribs. And the area of redness that came up here was mostly around that area. And so then using some cupping where that redness has come up. For lower back pain, you can use cupping around the areas of pain in pregnancy. Obviously, you're lying on your front like this when you're pregnant, but sitting up or in different positions or on your side, so that you can use the cups in different sizes over where there's areas of discomfort. For allergies, this is a great point here. Over do 14 there for allergy points or over treatment. If you feel like someone's been over treated, this is a lovely point just to sort of calm that over treatment down. So when we're looking at using cups, palpating for tightness or where they've said they're feeling tight. And feeling that there's a good suction. And there will be warning people that there may be some bruising afterward, but that shows up areas of stasis, and that's areas that you can continue to focus on, and you can leave the cups on for 20 minutes. And then sometimes they feel a little bit tender afterwards, but the relief will come a little bit later on, and that is works very well for that low back pain. Okay, so I have another few video things that we can pop up on the website if anyone's interested, just showing up how that redness comes up, and then directing clients so that you can, so that they can see how you do it. And it only takes a few minutes to do that. And then you can have a nice little lie down for 20 minutes with your cups on your back or your legs or wherever it is that you want to do it. That's all from me.
That was awesome, Kate. I look forward to having more comprehensive courses on healthy seminars. I enjoy sitting and listening to you, and the video demos are perfect. What's your website again, so people can find those videos and stuff you discuss?
How about I'll write it in the comments in the chat here.
Appreciate that. That'd be great.
Okay.
Next up is Emilie Salomons. Am I correct? Thumbs up for that. Yes. Next up is Emilie. And I know Emilie really well. She is AcuBalance Wellness Center practitioner. We've worked together for years. And to just show you the type of person she is, she's been with me for years. She's still with me. So that just shows you what kind of patience and an awesome person Emilie is, that she gets to hang out with Mind Sanity on a daily basis. So Emilie, let's unmute you and let you take it away.
Unmute myself. There we go. Now you can hear me, right? Okay, perfect. All right. And there we go. Let me see. Perfect. Okay. Yeah, I also really like that. I think I can speak for at least some of the people watching this, saying that we would love your videos. So please do send them or let us know how to put them up on your website so we can share them with our patients, because I think that's that's actually what I'm going to be talking about today, is how to utilize all of us here. We really are a community, and what we're doing here is trying to foster that community. And I know it can feel really overwhelming and isolating on a good day when we are able to leave our houses as practitioners. Not all of us work in teams. I mean, I feel very fortunate. Like Lauren said, we've been working together for 10 years, and so I can go to work and chat with other people, but not everybody has that. And right now, none of us have that. So to really foster that, what I wanted to do today is give some resources and a bit of an idea of how we're kind of doing our consults and how we're gathering our resources so that it makes it a little bit easier for everybody. Something I've found is that online consults seem to be more time consuming and more energy consuming than when we're in our own practice. It's easier in your practice. They come into your space, you have your systems. We've been doing it for a while. So you do your consult, you do your diagnosis, you put in the needles, and then you go to the next room to the other person, or you go to your office and you write things down. Whereas now we're at home, we're trying to do this in our offices or bedrooms or corners of the living room or kitchen. And then you end up afterwards being like, okay, well, how am I going to take what I tried to explain to the person and make it feel like it's valuable? So if you have a system already that's working really well for you, I would love to hear it, because I think what we want to do here is try and gather what is working for people, and so that we can all kind of get a system so you're not starting from scratch with each person. So I think the biggest thing that we want when we are doing an online consultation is it's like we're going in with our hands tied behind our back. We don't have our usual tools. We don't have the hands-on, we don't have that touch. And so what I've heard from a lot of people and what I felt myself is it doesn't feel as valuable. It doesn't feel as valuable, or it doesn't feel like you're giving them anything, let alone charging them for this. And so a lot of us can have these conflicted emotions on like, oh, should I be charging? Am I really doing anything? And so I think being able to go in confidently that, wow, you know what? I'm creating something valuable to my patient is going to help you in feeling good going in, and the patient's going to feel that. And then that will actually bring more people to you. So, all right. So I'm super, super pragmatic and so I've just written everything. There's no fancy pictures. There's no imagery, but what I thought I'd do is kind of outline how I've been doing it. And then from there, you can either take a screenshot and then create your own emails from that, or your own or share what you're doing, and I'm happy to update what I do as well, because it's not perfect. So first, so someone's actually booked in with you, you're excited, you've figured out whatever your software is that you're going to be doing. I do suggest video if you can. It is, although slightly more technical, it's a lot better when you're actually seeing each other. I find once you get over the camera there, or the computer there, you do slip more into the same kind of feeling that you have when you are one-on-one. So if you've booked someone in, you're starting, you would do as normal, kind of your normal intake and assessment. So that's going to be your interview. You're going to find out what their issues are, what they want treated, but you can also do like a facial diagnosis. You can hear the tone of their voice. I mean, a lot of us, so much of what we decide is done, especially with, like, say, the men who you say, well, how are you doing? And they're like, I'm fine. And you're like, you're not fine. So sometimes it's what you say, but it's also how they say it, how they look, how they move and they handle themselves. So none of that changes now that it's virtual. Your physical diagnosis, what you hear, all those things are going to stay the same. We just don't really have the pulse. The tongue, I will say that if you are going to take a picture of the tongue, what we've been doing, and on Jane, but you can do it through anyone, is first you have to get consent from the patient that you're going to be taking a screenshot of their tongue, and you're going to be uploading it. So you have your general consents that you're going to be doing through beforehand, saying like, okay, this is videoed. Do I have consent for that? You're going to mark that in your file, saying that you've received consent, verbal consent to do this consultation online. Then you have to get a second consent when you're looking at their tongue. And what I ask them to do is I ask them to walk towards a window so that the light of the window is shining onto their face. And then I get them to say, okay. And then I do it so they don't feel as stupid. And they say, okay, I'm going to get you to go right up close to the camera, and I'm going to get you to go like this, and I'm going to get you to hold until I say move. So I'll do it. I'll get them all the way up. I'll say, okay, hold there. And then now, Lauren, you can correct me. I always forget. I think it's Shift Command 4.
Depends on a Mac, it's Command Shift 4, and I can't remember what it is for a PC, but people that use
So then what you would do is, as they're hovering up there with their tongue out, you're just going to bring your cursor over, and you can do a screenshot of their tongue. That goes down to the bottom, and then you just upload it straight away to your file. Then that way you can go back and you can actually get a sense. And I like this so much that I think I'm going to do it once we go back into face-to-face treatments, because it's one thing to write down, oh yeah, I saw teeth marks and this, but to see the slight changes is actually really nice. So moving on, so you've taken their tongue, you've done their interview, and then you figured out your diagnosis. You're feeling, pretty okay with that. Then you go to the next thing, which would be your treatments. Now, we've had a great lecture from Kate talking about adding in gua sha and cupping, which are awesome because patients can do it themselves. With the cupping, you're going to get those silicone cups that can be sent to them. They can do that, have partners do it, but if they're alone, they can actually go in the shower and get soaped up and then actually stick the cup onto them. Well, not onto the breast, sorry, onto wherever, maybe on the hips or the backs or the thighs. And because of the soap, they can actually do like a fascial release along meridians. So this is something that you'd be able to teach them as well. So when it comes to the treatments, how we're going to offer value is a lot of the same things we do when we're in person. So first, you're going to go over your lifestyle tips. So your exercises, your sleep, all that stuff we still can do. You can go over all the diet things. I'll get everybody ahead of time, or anybody who I think I'm going to want to know what they eat. I will send them ahead of time a chart, a food diary. So if they've booked in, then I send them then like a week beforehand and say, over the next week, please fill this out and send it to me the day before you have your appointment. That way, the day before, I can have a look, I can have a whip through and say, oh, okay, I can see they say they eat well, but they're, missing, they're not eating enough vegetables, or they're having a frozen smoothie first thing in the morning. So then that gives you something to talk about as soon as they come in. You say, oh, thank you so much for sending me that. I've had a look through, and then you can dive right into all of the diet tips that you want them to do. And you've had a little bit of time, so they're not just staring at you on a screen and you're kind of trying to quickly, this is all stuff we do while the needles are in, right? So you could have a look ahead of time and you're prepared. You can also go through the supplements. This is where if you knew ahead of time what they were taking, you have a general sense, you'd be able to then add in as part of your treatment supplements, if that's what you do. As far as, the acupressure, gua sha, cupping, each province, each country, each state seems to have different rules on what can be done and what can't be done. So I've kind of listed all of them there. But really, it's going to be looking at what you can do in your region and what you're allowed to and what's going to be kind of possible. So you'll choose which ones. So they've already got lifestyle tips. They've got diet. They've got supplements. Now you're going to give them, you judge the patient on how keen they are. Like a type A is going to be gung-ho to get as much as possible. Someone else who's easily overwhelmed, you might actually want to do less, which will be a little bit easier for them to absorb and take on. So you kind of pick your keys. I'll usually give a couple of acupressure points, because the fact of the matter is once you get over 3, then they're getting confused about the location. And that can be a bit overwhelming. So if you already have lifestyle, diet, supplements, you throw in a couple acupressure or gua sha things that they can do as like a nightly homework. If you have studied Chinese herbs, or you're licensed to do that, that's where a formula might be appropriate. And then at the end of your treatment, and people say like, I don't think I can talk for 45 minutes. You absolutely, 30 to 45 minutes goes really quickly in a virtual consultation. And at first I thought, oh my gosh, what am I going to do? Normally I have needles in there. Every single one, I've been like looking at the time being like, oh my gosh, I only have 10 minutes left. Okay, let's get through, because you're showing them how to do it. You're getting up, you're adjusting. They're going to show you, say like, okay, did you say that's the point? I'll usually get them to like go up to the screen and show me where the point is. So you're kind of going back and forth a lot. So it does take up quite a bit of time. Before the treatment is over, I like to decide on a follow-up appointment. It's better to generally do that because you can explain why you would want to see them again and what you would do. Because a lot of times people are coming in their appointments thinking, all right, I'll get some tools, but like, then I should be done. So you want to give them kind of an expectation of what they would see at the next appointment. So for some people, like a new appointment, you might say, okay, I'm going to give you these homeworks. Let's see each other next week. And I want to hear how it's going, what's working, what's not. It's not going to be as long as our initial. Let's meet for 30 minutes. I want to be able to see you doing it, make sure that you're still on the right point. And then if something's not working, I'm going to add some extra points so that we can keep moving forward. And then that way they feel like, oh, okay, yeah. All right, I want to see you next week. So you decide on kind of the next appointment. Now, so that's like one idea of what you would do for a kind of an online treatment. What I've been noticing is there's a few people, or like a population of patients who have always come to you not for the tools, not the type A's. These are the ones who are literally coming to you for the grounding. And for them, that appointment might look totally different. That one, you might actually do a treatment with them. So that would be, all right, I'm going to get you show them how to do, say, kidney 1 and liver 3. All right, I'm going to breathe with you. And you'll do each point and you'll do the breathing. And that one looks different. That's going to be less of like here's a plan, let's get this done. You got that patient. And then you have the other one who maybe they have already some kids and everything's crazy and they're not going to be able to do this as much on their own. So they're looking for you to be that source. So that type of appointment might be less of the lifestyle diet supplements that you could send in an email after, but more just, all right, we're doing our 3 points, we're breathing together, let's do this. And you can do a whole like guided imagery, breathing, acupressure treatment with them. So you're going to have to, judge your patients or your style and go that way. Once you've done that and you've gone through the 45 minutes, and I'll always, at the beginning and the end of a treatment, I'll always ask someone what their expectations are, what their goal is. Like, okay, we're doing this. What do you really want to get out of this appointment? And so if you say it in the beginning, they're like, I just need to get rid of this hip pain, or like my acid reflux in my pregnancy right now is just killing me. Then you know what they really want to work on, and you can emphasize that. Then at the end of the treatment, you've decided on a follow-up. Before you go and end the call, you'll talk about like, okay, so we've gone over A, B, and C. I'm going to be sending you an email, so you don't have to write this down. Don't worry. But have I missed anything? So give yourself a little bit of a window at the end so you can really be like, have I missed anything? Is there anything? And they might say, oh, well, I forgot I wanted to. So it gives you a little time to talk about that. Or they're like, no, you've covered everything. Then you remind them that you're going to give them an email and that everything is going to be written in that email. And if anybody has ever gone on Facebook, they'll see that people love doing not surveys, but like questionnaires that then pop up and give them a whole list of things that tell them about themselves. Well, these emails that we give after our appointments are the same thing. It's like suddenly they have a whole email that is just like information about them, about their condition, about what they can do. And so a lot of people find that really, really valuable. So I'll just go to the next one. So what I've done here, and you guys can screenshot it, it is not like the be all end all email, but it's just kind of, I do everything in templates because I find that once I've gone through a bunch of patients, trying to think of like how to say things. I find if I have kind of a template that I work from, I don't miss questions when I'm asking people information, but also it's so much easier to take everything you've taken and then put it into them. So, you know, start off, dear Jane Doe, it was lovely to see you or meet you today. If their partner happened to be there on the call, then you'd add the partner's name. I'm really excited to support you on your path. I understand you've come to me for, and this is where they feel like they're heard and they're seen. You've come to me because you have, you know, painful, burning heartburn that seems to be worse in the afternoon. So they're like, yes, that's what I said, you know, like then they really know that you have heard them, what their issue is. I wanted to follow up and summarize some of the key points we had from our discussion and the recommendations I have to support this goal. Then it's really clear, like, okay, yeah, this is what we're fixing. Okay, we're going to fix my problems. And then I put chief concerns. Usually they're not coming in for one thing. There's a host. So I put kind of like from most important to least. So heartburn, hip pain, anxiety, something like that. So they're really seeing that like, okay, we have covered everything. So this is the first half of my email. I couldn't fit everything in. So from our appointment today, there are a few areas I think we can improve on. I'd like you to be mindful of these signs and symptoms so we can track and measure how they are shifting and improving. So then you would list those. Then, and then you would go into your treatment plan. And so in order for us to work as a team to optimize your health and wellness during this pregnancy, these are the recommendations I'm making. And this is where everything you've talked about in your treatment, you can put into your email. This is also where I have created a Google Doc for us at AccuBalance, and all of the docs have put in their favorite resources into a Google Doc. And I highly suggest this for everybody who isn't already doing it, because what happens is we use the same things. Like I use for fertility patients, like femoral massage often, now that we don't have acupuncture to increase blood flow to the reproductive organs, I get people to do femoral massage. So a lot of my, in the follicular phase, so because so many patients are getting that, I have like Randy Lewis's video that I found on the internet. I have a chart that or a handout that I normally give people in paper. And I have that in the section that we have listed fertility. Then when it comes to acupuncture or acupressure, I have the list of all the common points I do with the picture, the image of the location, and then like a description of like where the location is. And then Debra Betts on her website, she's added in the acupressure section, she's added little YouTube videos that are just the location of, I think, like 5 or 6 points. Like there's bladder 32, there's spleen 6, there is bladder 67, large intestine 4. So I've added the YouTube videos in my Google Doc so that when a patient comes in and I've decided, oh, she definitely needs stomach 36 or maybe bladder 32, I can just cut and paste or drag and kind of drop the location, the point of the little video. And then if there's a gua sha thing or something, you know, like that's why Kate, I'm like, oh my gosh, Kate, I need you to put those up, because then I can have a little section in our Google Drive that has the gua sha. So you're not having to start from scratch with each patient. You're literally just going, okay, this patient, this is what I thought they needed. I'm going to drag that, drag that, drag that. You have your template that you tend to use for your patients, and you just shift and move and change what you're suggesting. So it's still a very personal email to them. Like this doesn't look like some, you know, oh, you give this to everybody. It's going to be specific to them, but it's easier for you to work with, so that if you have 3 patients, you're working off the same template, but if you look at them, they'll all be very different because they have different conditions. So diet. So I've done, say, my acupressure, I've cut and pasted the images, the locations, and I put like a little blurb of why. You could have like 3 people you're all going to suggest liver 3 for them to do, but one person, it's because of like more of a liver chi, another one, it's more of a nourishing, another one, they're doing it with kidney 1 for grounding. So I don't have a standard of what the point is doing. I have a standard in where the location is, but then I like to put what this point is doing for them specifically so that they can connect and they can want to do that point. They're like, yes, that's exactly why I want the point. If it's too vague or it has other things it does, sometimes they can not connect with it as much. So I've listed each point here with the purpose of each point, and then video or image included. So that's kind of in point form. And then the diet. So we talked about your diet. These are the suggestions these are my suggestions, don't have something frozen. We have kind of a set thing that we often tell people about, like having warm in the morning, starting with like a hot water and lemon, and why. Sometimes I'll use that. Sometimes if someone's easily overwhelmed, I'll just put like, try and have a few more vegetables, or, like, you're doing a great job. How about you try this one thing? So you're, again, gauging the person. Sometimes you'll do a lot, and other times you'll just do a few little things. Then you could put say, customized herbal formula. This is what I'm suggesting. You can put your instructions there as well. And then also on the formula that you're sending them. And then supplements, the following supplements I suggest doing with it, and then the dose, because they will forget immediately. So it's there in the dose. Exercise, sleep, mindfulness, meditation. So in our Google Doc, our shared Google Doc at work, we have like our favorite mindfulness things that you can find from the internet. So like anxiety ones, pediatric ones, sleep ones, so that, again, you're not having to then search for it. You're just drag, drop. This one, this person needs. This one, this person needs. And then if you think about it here, then I end with, I look forward to supporting you. Please feel free to reach out if you have any questions or concerns, maybe something personal if they had mentioned it. I hope all goes well with your Zoom school class for your kid tomorrow or whatever. But if you think of it here, and then they get this email, like usually by the end of the day, I tend to do it. They get it at 10 o'clock at night because I have to wait until my kids are in bed to be able to send all these out. But then they're getting this and they're like, wow, this was like awesome. I had this whole, and they have everything. They have a plan. And when they forget, they can go back and it's there. So you really have this huge resource that you have given them that they can connect to. Then you see them. So you've given them the treatment plan. I think I have another one. Oh yeah, this is my personal. I'll go back to that in a sec. So yeah, for follow-up ones, it's not quite as lengthy because the initial ones, you're kind of giving all the diet stuff. The follow-up one, I usually have like it was great to see you again today. And then here are reminders of what we talked about and what you can do. And then it will kind of go through what's new, what's not. And then that way they can feel like they have what's different this time, or like added acupressure points. So when it comes to resources, I've just put this up. I don't think we give any handouts to free courses. So I would just get people to screenshot this. These are some of the resources that I really like. Okay, I don't love mine, but I thought I would add it in case people need it. I have created 4 videos so far that are acupressure lifestyle videos that are on our website. So the website there is just the AccuBalance website, and you go to conditions and treatment in pregnancy, and all 4 videos are there. However, if you don't want to have to send people to our website, which I totally get, that's fine, you can actually click on the videos, and it's a YouTube video. And so you can, if you just want, like, maybe you don't want them to see the birth preparation stuff because they're there in first trimester, you can actually just take the URL for the YouTube video of early pregnancy and send them that. The acupressure location videos that I mentioned of Debra's are great. And so I have put she is the acupuncture.rhizome.net acupressure one. Kate's are going to be great for gua sha. Then relaxation guided imagery. So I'll do like pregnancy, anxiety, sleep ones, and I'll just kind of have them in my section. Diet, I will put blogs that I have written or colleagues have written about different things. Like I have like a foods to avoid in pregnancy blog that I'd written. So, for those people who are new pregnant, I can just send them that one. Supplements, I have like a pregnancy supplement 101 blog that I did. So again, you're not having to write things from scratch. You're just, here's this one. This one is good for you right now. And then exercises. Just favorite exercises, common exercises that you do. So then this way you have everything there and you can just use it on an as need basis. And then books, you're right. There's also like books that your favorite books that you recommend for people who are interested. Say, I don't know, Claudia's book maybe, but but like there's the key is that you build with the resources that you like. Yeah. So here you can see my videos on the AccuBalance website. So they're all in one big row, but if you want one, you can click to it. And there's like a share button. Yeah, if you go to YouTube there. Please don't play.
Just showing them where it is.
Yeah. So that's that. Like if you're going to be doing a web appointment during a labor, that's going to look completely different. This is for like people who are pregnant.
I want to thank everybody. So I have to say a few things. First of all, we're getting lots of emails. Thank you for all this information and how can you be doing this? Because people like this show up and just deliver amazing content. So how can you not want to keep doing this, right? It's just such good content. And you can see they're just giving you so much information. So I want to thank our presenters, Zena, Kate, and Emilie. We're going to go into our panel discussion now. I also want to give a big thank you to Sandra and Lorianne, who are more behind the scenes, that are working crazy long hours. So all this is happening because we're not sleeping. And so I want to just say a big thank you to you guys. I really appreciate it. So thank you. All right, our panelists, let's make sure they're unmuted. I want to remind you, healthyseminars.com/resources is where you find all these lectures that are coming up. So at the top, we'll list the upcoming ones. We have 2 herbal ones tomorrow. We just have lots of exciting talks. And I'm going to do a Conscious Tuesday on April 28th. So if you want to tune into that one, you can find that on the healthyseminars.com/resources. And a reminder, during the month of April 2020, our pregnancy courses by Debra, Claudia Citkovitz, and others that offer the pregnancy courses are on sale using the coupon code HEALTHY25. All right. If you have questions, raise your hand digitally, and we'll do a few questions. So at the bottom of the screen, there should be a place to raise your hand. And if you're on an iPad, I think you click more. And is there anything else that 2 of our panelists who haven't spoken, Claudia or Debra, if you're still here, that you would like to add before we see if there's anybody who has questions?
Thanks, Lorne. I can see you haven't unmuted yet, Claudia, so I'll go first. Just that this is really, I think, it's just fantastic to be part of a community like this with all these, inspiring people going out there and delivering this care and thinking about how they can deliver, individualized care online, making it different from sort of just an information website that might be more generalized. I think it's really, to me, it's been an interesting time of trying to find out what I think I deliver and focusing on that rather than trying to look at the needles. And I would say one of the things that I think is quite different doing telemedicine, and I've had to really get my head around, I actually send out forms like you, Emilie, beforehand, so that when they come into a consultation, it is not the same as when I'd normally meet someone and say, hi, how can I help you? I've already got a form where they've filled out what they want to focus on, bringing up any red flags. So I've already done my initial consultation on paper before I see them. And that allows me to spend more time talking to them. Because as Emilie said, it's quite different. And I think that's just getting your head around and trying it. And in future, we'd kind of like to share in this forum problems, troubleshoot, things that worked well for us, because it isn't taking your normal consult, or for me anyway, shifting it onto a video platform. It's a completely different approach. And I will just say it's quite fascinating because I'm going into people's homes and I'm in their bedroom and in their lounge and I'm seeing them laughing with their partner, or it's just quite different. It's a different feel.
Mm-hmm.
It's not necessarily worse, but very different. So, Claudia?
Yeah, I agree. I had a spate of them this week, and there's something quite intimate about it, actually. You know, they didn't come out to your neutral business space. There you are. And it's interesting that Emilie was, do I have it right, Emilie? You're finding 30 to 40 minutes is sort of a sweet spot. That I was thinking it was going to be a 20-30 minute thing, but it wants to be in a little more depth. And I think people, I don't know, there's a dose, and just like with needles, right? 30 minutes seems to be the dose of the exposure time, and anything a little shorter is a little shorter. I'm curious about, I don't need to know the exact number. I don't know Canadian dollars anyway, but as a proportion of your office price, how people decided to price it in relation. I just made it arbitrarily kind of half as long and half the price. But I'm not sure that's the perfect solution. It's just what I did. Anyone have any?
Asking about, like, well, I could say what we do. We've had lengthy discussions at AccuBalance about what we should do. So what we've done is we've actually kept the price listed the same as the in-person price, but then discounted it so that they see the discount. Because the thing is, once you go back, what we're talking about was like, once you go back, then people are going to be like, oh, I don't want the in person. Yeah, I want the half off one.
That takes all your time.
That takes up twice as much of your time.
We're not selling time also. We're selling value. Because if you're selling time, if you're selling a commodity, then you're competing on price. And then you have to be as cheap as the next person is next to you. So we don't consider ourselves as acupuncturists. We consider ourselves a solution to their problem. And so what tools do we have available to them? So it's the value. And if Emilie can sit with somebody in 10 minutes and tell them what they know, their story, and tell them what they need to do, another person needs an hour, well, why doesn't Emilie get paid well for her 10 minutes? It took her 20 plus years to be able to do it in 10 minutes versus somebody just graduated. The reason we discounted it is we're being respectful that it's isolation time and a lot of people aren't working. And so we just wanted to be empathetic. There's empathy there. And so here's our prices, here's our value. And we understand right now we're in very special times. So during the month of April, these are our prices. And then if things go back to normal, we have a hybrid clinic, the prices will go up. The people that are working are loving it because they're not affected by the financial situation. And now they got a really good deal. So they're really loving it, taking advantage of it. So that was kind of like, we really thought about it. And, you know, my idea here in the clinic is the health entrepreneur is, what's the value? And if we're a solution to the problem, then there's value and people will pay for it. And so that's our goal in the telehealth as well, whether it's cupping, whether it's gua sha, whether it's dietary. And like Debra said, we didn't move our in-person clinic and just threw it online. We started changing it. As you know, pictures of the tongue. Well, now we send them, you know, for our non-pregnant patients, our fertility patients, we send them images of blood, like color platelets, so they can tell us what color it is, and we give them sizes of clots so they can look at. We have caricatures of bowel movement. So what shape is your bowel movement? So rather than just a verbal discussion, now they're having a visual. So we will bring that into the in-person now, because having them look at that before they see us and to really be clear on, is this what you call pellet, right? Is this what you call bright red? We just think it's going to make our in-person better. So pricing will be personal for you guys. And you, first of all, have to believe it's valuable. So first you have to believe it, because if you don't believe it, they smell that and it ain't going to work for you. And then the second thing is they actually have to perceive the value. So it starts with you. Do you feel it's valuable? And if you don't feel it's valuable, they probably may have issues feeling that as well. And then communicating that value to your patient is the key. And again, don't think of yourself as an acupuncturist. because people don't come to you for acupuncture. They come to you because they think you're a solution to the problem, and you happen to use acupuncture to be that solution. And now you're going to use other tools to be that solution. That's my opinion on that. Let's get a question here from Yvonne, though. Yvonne, I'm going to unmute you. You should have mic rights.
Thanks. Emilie, when you asked what we were doing, I felt the same thing. I felt chicken to ask for money, but I'm not working, so I got to ask for something. So I also reduced my rate for 25%, but I still kept it in a whole hour. A whole hour. We're going right to in fact, we went over our hour. We was like an hour and 10 minutes. And we're doing everything. We're doing moxa. I'm sending things to people. We're doing moxa, qigong. We're doing some just regular breathing exercises. And I'm just doing so many things. And I think I was so exhausted afterward. I mean, I felt like I was doing a lot. But she really appreciated it. She really needed it because, she is a recovering cancer patient. So she's getting cancer treatments, the chemo treatment, and she's getting some mistletoe injections, and she doesn't want to give me up. So I'm still doing what I can, and it's long. It's a long deal. We're doing a lot of things. And then, I feel like, okay, that's a lot. And then I thought, well, she needs it. She's special. But then I had another patient who, if she squeezed something tight, her hand was like a tremor. She had tremors, but only with pressure. So I said, okay, we're going to just do 4 points. And we did some points. I said, now pick up that, whatever she was holding, and press it again. Her tremor was gone. I didn't really think it would go away. Then we did a couple more points. And I said, now pick it up again and let's do it. It was gone. And so, you know what? I thought, oh my goodness, I can't believe over a live video session that I could help her so much. And I thought, wow, I'm putting so much effort into this. I almost feel like it was more than if it was in my office. So you know what? I'm like, when we all have money, it's going to be the regular price. It's not going to be discounted. It's going to be the regular price. But for now, I'm doing everything cheaper because nobody's got money. So it makes sense for me to charge 25% less. But I mean, it's not like I have a ton of people. Just those who really want to come are coming.
And like with anything in the beginning, like when you're a new grad and you do 900, you do front and back treatments and this and that, and you try and give everything because of an insecurity. I think the more we do it, probably the less we'll do, but more like we'll have more confidence. And so I think naturally you kind of get more honed in. In the beginning, we are going to do everything as kind of you just want to make sure you give value. I think we've got another one, another person raising their hand. Thank you so much. Did I see someone else?
No, that was Yvonne.
That was just Yvonne's. Okay.
So what I want to do now is I want to open up the mics where you guys get to connect to each other, because this part of our intention right now at Healthy Seminars is to create community. There's the learning part. You got that down today. And now it's just community. So you get to connect with each other and send your love and gratitude to our five obstetrical acupuncturists. We got Kate, Emilie, Zena, Debra, and Claudia. So open up the mic for a minute. Yes.
Before you start, there was someone who asked a question.
Sure, go ahead and read
Jennifer.
it.
Jennifer has
yes, I have
a clinical question.
Sorry.
Yeah, go for it. Hi, Jennifer. Nice to see you.
Nice to see you guys. Thank you so much for putting on this presentation. It's really been wonderful. Is there anything that you guys would recommend for somebody who has like a complete placenta previa? How would you do that remotely for treatment? If any,
we've had long discussions about this one. Complete placenta previa, absent a magic anti-gravity machine. Yeah. There's, especially if it's really truly in front of the os. That just kind of is what it is. The placenta cells are on the uterine wall. There's maybe some range between providers as to whether that's it. There's a one-to-one relationship. It's going to be what it's going to be. Don't even bother with your moxa. And it tends to be, it's certainly clear to me it happens more in spleen Qi deficient people. So it's obviously a result of spleen Qi sinking, right? It's the placenta should plant right up here, and instead it plants down here. So I certainly think that if the person presents a spleen Qi deficiency, it's the right thing to do to try to help their spleen Qi be stronger. But a good half of placenta previas that are found at week 32 or so, 31 or something, will resolve themselves. So if it does, you can rejoice with her and you don't need to take credit. And then sometimes it won't resolve. And especially if it starts out over the mouth, it's not gonna magically rise up. But anyone else have any thoughts? Have I summarized everybody's positions accurately enough?
Yeah, thanks, Claudia. And I would just like to say, reassure her that if she needs a cesarean, there are things that you can do to help her prepare for a positive cesarean birth, which is what we talked about last time. My concerns about this is just credibility, because as Claudia said, a huge percentage of them will resolve, and the medical people know this, and I don't really want women saying, oh, my acupuncturist my placenta previa, and they'll be going, oh, those witchy people, you know, those would be saying, what rubbish, this was going to happen anyway. So it's about you keeping your credibility. But as Claudia said, if they are spleen Qi deplete, you're only going to help them have a better birth, whatever happens, if you address that. It's just being clear with the woman about what placenta previa is and what our role is in it. Does that make sense?
Yeah, thank you so
The other
much.
thing I would like to add is to also, do you know what week she is right now?
She was week 20 when they found it.
Okay, yeah. So like Debra and Claudia said, there's a good chance that it could resolve. But also there's a good chance that she could have bleeding. And so it's also good to know whether she's anemic and really fortify her blood, because that will help with just the recovery from the bleeding. It will also help with the pregnancy. But again, like ultimately, like we all know, finding out her symptoms and really addressing her underlying causes, because there could be many different ones. But you'll want to think about the blood and anemia as well, because a lot of times with placenta previa, people have bleeding episodes, and that's where I get to see them when they get admitted to the hospital because of the bleeding episodes. And also at a certain time, they'll get admitted, usually around 24 weeks. So yeah, those are the things you'll want to consider. And I totally agree with Claudia and Debra to ultimately support them and their constitution, so that either it can help resolve it or just help prepare them for losing blood if they do lose blood, and or surgery.
Thank you so much.
Yeah, good question.
All right, let's get ready to unmute everybody. And again, if you guys missed the first module, the first series that they did a couple of weeks ago, healthyseminars.com/resources. And if you go to the virtual consultation link for this series, it'll take you to the page where you can watch the replay from the one before. All right, it's our chance to connect as a community, unity, immunity, say hi to each other, and let's give our love to our 5 presenters today as well. Unmute.
Hi, everybody.
Thank you very much. Thank you very much.
Thank you so much. Thank you, Emilie.
Hey, everybody.
See you all.
It's so nice to see all you presenters.
It's so nice to do it all together.
Thank you, Emilie.
Joanna.
Bye.
Good luck,
Don't let
you.
that on your body.
Fingers crossed for a wonderful birth.
Stay healthy, everyone.
Be well.
Be well. Bye-bye.
You all again.
Thank you.
All the best.
Bye.
Jackson didn't use the glue.
Some of those things, but it's
Thank
not
you.
like Hawaii or Puerto Rico.
Thank you.
Or, some of the real tropical islands.
Mm-hmm.
But it was just, I mean,
Thank you.
Thank you, Zena.
Bye, everybody. Take care.